Good afternoon. My name is Kristen Hebda, and this is my final project for Practicum 1 in the Vanderbilt School of Nursing Healthcare Leadership Program. During this semester, I participated in a nursing tech pilot program led by my preceptor, Diana. The objectives identified for this presentation are as follows. Introduce the preceptor and the location of the Practicum experience. Introduce the tech pilot program that was the focus of this semester's clinical practicum. Demonstrate management strategies learned through the course. Discuss the next steps toward the pilot implementation. And describe the lessons learned throughout the course. Southern Hills Medical Center was the location of this practicum experience. Southern Hills is a community-based hospital in Nashville, Tennessee, and is growing in both quality and popularity. Southern Hills is part of HCA's TriStar division of hospitals. The second floor medical unit, on which the pilot was performed, has 28 patient beds and has recently earned their stroke certification from the Joint Commission. Diana Morrow spent the semester acting as my preceptor for this practicum course. She's been a master's prepared nurse since 1999 and has been in a position of leadership for 15 years. Diana has been the director of the medical unit at Southern Hills for almost 3 years. Prior to this leadership position, Diana has worked as a quality manager, administrative supervisor, clinical manager, nurse educator, clinical coordinator, and staff nurse in various areas, such as ER and ICU. What was the purpose of this pilot program? When I approached Diana to see if she would be interested in acting as a preceptor, she introduced the pilot program to me, stating how beneficial it would be for the both of us to work on this as a team. She thought it would be a great learning experience for me to see how to implement a pilot and that she could use the assistance. Some of the reasons the pilot was proposed to administration included a decrease in HCAP scores, an increase in patient falls, physician and staff complaints related to the workload of the nurses. With a nursing tech assigned to only some of the patients on the unit, some nurses were feeling overwhelmed, and the patients were complaining about long wait times for the bathroom or bedpan assistance. Diana aimed to find a way to prove that having a CNA assigned to each patient would be beneficial for all parties involved. HCAPS results. As you can see here, patients who reported on the HCAPS survey that they always received help as soon as they wanted it was fairly low, with a 66% average. With the Southern Hills response rate lower than the national average, Diana and the rest of the leadership team set out to increase survey results related to response time. This bar graph shows that Southern Hills had the lowest reported HCAP scores compared to the state and national levels when asked if patients received help as soon as they needed it. This was one of the main reasons for the CNA pilot. Southern Hills HCAPS results for this question were about 63%, whereas Tennessee was at 69%, and the U.S. overall was slightly lower at 68%. HCAPS questions number 4 and 11 relate to the responsiveness of the hospital staff. Southern Hills has a 2 out of 5 star rating in the responsiveness category. These are both reasons that these need to be addressed. The responsiveness data was reported from 835 Southern Hills patients who returned the HCAP survey after discharge. Call lights and alarm fatigue. An important objective of the pilot was to decrease the alarm fatigue among the nursing staff. Only 52% of nurses reported that a majority of their call lights required nursing attention, which means that 48% of the calls can be deferred to the CNA. These are usually calls for water, help to the bathroom, or repositioning. 51% of the call lights do not pertain to patient safety issues. 53% of nurses are being taken away from the critical aspects of their job because they're answering these call lights. This can contribute to safety issues, such as medication errors and patient falls. One of the goals of the pilot is that nurses' phones would ring less often, which would contribute to less alarm fatigue and safer medication administrations. Reducing the alarm fatigue caused by call lights is one of the 2015 National Patient Safety Goals enforced by the Joint Commission. By having a CNA as the first line of defense against call lights, we hope that falls can be reduced as well. The 7 P's of hourly rounding. These are mnemonics that can help us remember the things that should be assessed during hourly rounding on patients. Preempt the call. Hourly rounding should reduce the patient's need to push the call light at all. Promptly respond. Patients are less likely to get up and walk to the bathroom by themselves if staff is responding in a timely manner. Potty. The nurse or tech should offer assistance to the restroom at each hourly round when the patient is awake. Provide information. Answer questions about plan of care and daily schedules. Pain. Ask acceptable and current level of pain on each rounding. Position for comfort. Reposition immobile patients every 1 to 2 hours, and assess for comfort and rearrange pillows as needed. Place items within reach. Be sure the patient's personal possessions are within reach before leaving the room. And any staff member should be asking the patient if there's anything else they can do for them before ever leaving the room. The CNAs and the nurses should be participating in hourly rounding. Rotate hours to increase efficiency and effectiveness. For example, the CNA can round on even hours, and the nurse can round on odd hours. This technique can limit the time that the patient goes without seeing someone in his or her room. The goal of the hourly rounding using the 7 Ps is to increase patient satisfaction, which also increases HCAHPS scores and decreases falls on the unit. This image is from the Studer Group's educational information on hourly rounding. While this shows the 4 Ps, all of these programs highlight the same major components: pain, position, potty, and possessions. So why was this practicum problem selected? Since I first chose Diana to be my preceptor, we planned on this pilot program as being the focus of the practicum experience. This was partly because of the large scope of the project and the length of time that it would take to complete and evaluate for its effectiveness. We anticipated the pilot would encompass the entire semester, but never expected that after 4 months it would still not even be implemented. Fall prevention. Fall prevention was one of these main reasons that Diana and the administration team decided the CNA pilot should be implemented. As the 9th National Patient Safety Goal, fall prevention is an important standard of care enforced by the Joint Commission. The image on the slide shows an article I found during research in this course entitled "The No Fall Zone." I presented the article to Diana, who thought it would make a great elective learning piece for the nurses and techs on the unit. During my research, I also found this training course for CNAs related to fall prevention. I presented this information and the usefulness of this training course to Diana, who plans to start teaching it to techs in early January. Hopefully, educational opportunities, such as this one, will help reduce falls on the medical unit through the implementation of this pilot. Management strategies. Through course material, conference calls, and clinical hours, I have learned a great deal about effective and ineffective management strategies. Transformational leadership was found to be the most successful leadership style, in my opinion. From previous courses, I had thought that transformational leadership was a style that I wanted to become more familiar with, and this clinical helped me do just that. One point that resonated with me from the last conference call was that transformational leaders are really good at helping staff understand the why behind the decisions that are made within the organization. The transformational style leadership techniques that I've learned during this course are something I plan to practice in my own future leadership opportunities. Critical thinking. Because of this course, I was able to fill in for my director and another unit's director while they went on vacation. This was the most valuable part of the practicum experience because it taught me critical thinking skills in real-life situations. I learned how to run a surgical and a rehab unit, gained respect from staff members, managed all patients and employees, made the staff schedule, ordered supplies appropriately, rounded on patients daily, handled staff and patient complaints, and gave recognition for outstanding patient care. A great deal of critical thinking was also used in the process of implementing this pilot program. One of my assignments was to update the medical unit staffing grid to accommodate having a CNA assigned to each patient. This was a task that took a few weeks to accomplish and had to be revised many different times. This is the staffing grid that I was speaking about. It shows how 1 to 2 CNAs are required at all times to keep the pilot program afloat. Because this is a pilot, the number of licensed nurses will not have to decrease due to the increase in number of techs working at any given time. For example, in a normal staffing grid, 1 RN would have to be given up in order to have an additional CNA working. This is the grid that we spent weeks of practicum working on to come up with the ideal staffing solution. The project outcomes. The pilot program was put on hold for the second time since the beginning of the course due to budgetary restrictions. It is anticipated to resume in January of 2016. Project completion. Due to these budgetary restrictions, the outcome of the pilot cannot be anticipated at this time. 5 of the 6 CNAs have been hired for the pilot. 2 are full-time day shift CNAs, 2 full-time night shift, and 1 part-time mixed shift CNA. 1 remains to be hired when the hiring freeze is lifted in January. What are the next steps? There's still a great deal of work to be completed on the Tech Pilot program. We have to educate and train the CNAs who were hired for the pilot. New hires must attend a new employee orientation, and all CNAs will be required to participate in the training programs discussed earlier. Starting in 2016, we can continue progress on the pilot program. The program's effectiveness should be monitored at regular intervals, starting weekly, then monthly. Once all data and information about the pilot's successes or failures have been evaluated, the findings should be presented to administration. Then we will decide if the pilot proved the hypotheses and if it's worth continuing based on the new grid and a cost-benefit analysis. Lessons learned. I have learned so many lessons throughout this course, but the leadership skills are the most valuable point. I have also learned how to have confidence in myself and in my leadership abilities, which is a very important trait. Related to the pilot implementation, I learned that finances are a driving factor in healthcare organizations. I've also learned that plans, especially in the hospital setting, are constantly changing and that it is important to be flexible to these changes. The last point that I realized over the course was that pilots are extremely difficult to implement. That's all. Thank you for watching this presentation about the pilot implementation and all the work I've been doing throughout this semester. I hope you enjoyed. Thank you.